Hello everyone, this is Bridget. We are going to be doing a whole bunch of smooth threads on my patient. So this patient came in, she originally just wanted to do her vermilion border just to give herself a little bit of pop, prevent any migration, just because she has had filler in the past. So then we kind of just decided to treat her entire lower half of her face. So she has had smooth threads before, so she kind of knows what to expect. They're a little bit pinchy on insertion. I always topically numb the patient just to make them more comfortable. So I'm basically treating nasolabial fold, oral commissure area, and then we will do her vermilion borders as well. So you'll be able to see all kinds of different threads that I'm using when also doing different techniques. So you can see that I'm struggling a little bit more with these threads. They are the twisted 2940 threads by VSoft. So they're a little bit harder to kind of insert just because they're wound around that needle. So you can see it looks like a little screw. That is going to make it a little bit more difficult, cause a little bit more trauma. So it's going to stimulate more collagen over time, which is exactly the point of a smooth thread. So over the next few weeks, usually by 8 weeks, they're fully dissolved. The body just senses that there's traumatic injury there and replaces it with collagen production. I do always recommend patients doing multiple sessions, just because, doing one session, yes, you may see a little bit of a result, but optimal is about 3 to 4 sessions depending on the person. And after that, it's just maintenance a few times a year, just kind of like whatever the patient's budget and how much time they have to heal and things like that. Because it can cause a little bit of bruising. You can see that I'm poking her a lot of times. I think we ended up using like a total of 35 threads. So that would be, 35 total injection sites that I'm doing. I try to keep them all to the same area to try and, like them have bruising in one area versus all over their face, but you can only do so much. So I am now kind of finishing up these twisted threads. I'm just kind of spreading them over both nasolabial fold and oral commissure. I will layer some mono smooth threads in there as well, which is what I'm switching to now. So you can see that that's much easier to glide into the tissue. And when you're at the right depth, your patient should be extremely comfortable. Like, yes, that initial pinch they might feel, but once you're in there, it should be relatively comfortable for them. If they're kind of squirming or complaining, you may be too superficial or too deep, just depending on, where you're at in the tissue. So just make sure to go slow because you can't back up with these threads. So once you start backing up, that thread's going to engage into the tissue, and then you're not going to be in far enough, and then you're going to be in too far, and you're not going to be able to get it out. Or you're not in far enough, and the thread's going to be sticking out of the face. If that ever happens, you're just going to pull it with a clean pair of tweezers and then place another one in the same spot. It's no big deal if that happens. But if you are a little bit superficial and your thread is fully buried in there and you can't get it out, just leave it be. If it's really bothering the patient, like if they can see a little blue line, like it'll almost look like a little vein. If that ever happens, you can have them apply heat about 3 times a day, and that can help break down that thread quicker. So that is one little tip that I always recommend doing with threads is if somebody's having any complication and it's not like infected or anything like that, I always recommend applying heat just because that will break the thread down quicker. Smooth threads, you don't see it as much, but with lifting threads, you definitely have a little bit more room for complications to arise. Smooth threads, pretty easy once you kind of insert them. They're so tiny that even if you can see them under the skin, usually within a few weeks, they're dissolved. So usually it's a little bit easier to handle. So you can see I'm kind of just covering this entire area. These are the 2930 smooth threads that I'm using. So I'm kind of using a mixture between 2930 mono, 2940 mono, and 2940 twisted. So again, just those twisteds are going to stimulate a little bit more collagen. And that's why I'm choosing them, just because this area tends to be a little bit more stubborn and is one of her main concerns. But the vermilion border, like I said, you'll have to do multiple sessions of smooth threads. The vermilion border is one area that I don't always do multiple sessions of. I feel like my patients don't always need it. So It just kind of depends on the case, but usually if they've gotten lip filler in the past, I'll just do it when they get their lip filler, so maybe like once a year. But if the patient really likes the result, then like I absolutely will do them as often if as they want. It really isn't going to hurt to keep doing them, and it's going to do nothing but stimulate collagen, which is going to be great for their future, and help prevent any kind of anti-aging. This patient does pretty much every treatment under the sun. She's done Sculptra, she's done filler. She gets full face tox every 3 months, so she keeps up with everything. So she looks really, really good, and she's just kind of maintaining those results now. So her Sculptra is fully settled in. These smooth threads are just kind of like a topper. It's just really going to help tighten that tissue. Smooth threads are also great for things like acne scars. It helps kind of release that adhesion from the scar. And then also stimulating collagen, so it will help kind of build out the volume in those deficits in the skin. So that's one area where I always see really good before and afters. So that's a great area to start if you're newer to threads. I'm throwing some arnica on now, which just helps with any kind of bruising or swelling. You could say nothing crazy yet, but she probably will be pretty bruised over the next few days. But that should subside, within 10 to 14 days fully. Arnica gel is great for healing, so I like to put it on post-procedure and kind of leave it on until it absorbs. They can also take arnica tablets, which are great as well. I hope this helps.